name is Brandy Berry, and I am the program supervisor for the Kent County Health Department's Children's Special Health Care Program, as well as the Fetal Infant Mortality Review Program.
Hi, my name is Becky Doucette, and I am one of the public health nurses on the Children's Special Health Care Service team in Kent County, Michigan.
Hi, my name is Lisa Kuiper. I am also a nurse on the Children's Special Health Care team in Kent County, Michigan.
Welcome everyone. Today we will be talking a little bit about barriers to services here that we've seen with rare diseases. And I wanted to start off a little bit by talking about myself and sharing my personal story. Not only am I the program supervisor for Children's Special Health Care Services, but I also have a child with a rare medical disease. So I'm going to talk to you a little bit about my Charlie. Charlie was born 9/9/99. He is my sunshine baby, and when he was born, my first child, just very normal birth, pregnancy and everything, but when he was born he had lots of reflux, kind of a fussy baby. I had a lot of support, so nothing seemed kind of abnormal at the time. As he began to grow and move into his toddler phase and preschool phases, though, I would notice that he still would continue to vomit, just like in infancy with his reflux. And that went on for quite some time. As he prepared for school and started going to preschool, Head Start preschool, and especially as we entered probably kindergarten, teachers would start to send him home frequently because he would vomit at school. And you know, when educators see vomit, that typically equates illness. So his preschool years and kindergarten, he was sent home a lot. I spent a lot of time at the school and picking him up. And I would talk to his doctors, but there was no real reason as to what was happening. He wasn't ill. There wasn't any, they would run tests. There was nothing they could put their finger on with regard to what would be causing this. So it was probably thought that he's just probably a little bit nervous or uneasy about going to kindergarten, first grade. Okay, that seemed fairly normal. As we approached first grade, there were other things I started to notice about Charlie's behavior. Simple things that they would learn at school, you know, everything is repetitive at that age. And as I would try to teach him things that he would learn at school and the teachers would teach him, it just wasn't sticking for him. He seemed kind of a step behind, if you will, a step behind the other kids. Things weren't coming to him as natural as some of his peers. And he still would get sick on occasion, especially if you pressed him to learn something or pushed him to learn information. It would make him visibly nauseous, and hence he would vomit. As he began to wrap up the first grade and we were heading into second grade, honestly, I was very frustrated with public schools at that point because I had tried to get a lot of, any amount of support in the school system. And his doctor's office, frankly, were pretty frustrating to me too, because I would ask questions and it was kind of put back on me like something's happening in the home that's making him ill. Something is wrecking his nerves. It's all behavioral. And okay, understandable. And this is my first child, so I really didn't know what to do with that information. And I would try to talk to my family members, but nobody had a child who was experiencing any of this. I mean, it was to the point that anytime we'd leave the house, we'd have 2 or 3 plastic bags, a towel in the back seat, a wet towel, and the other family members and other kids would call it Charlie's Get Sick kit. I would be carrying ginger ale and little ginger snacks for him to eat and settle his stomach. Like, we couldn't leave the house. He was vomiting every day. So going into the second grade, I put him into a Christian school, and the teachers there, I mean, there were less kids than in the public schools, so they were able to spend more time with him. And whereas the public schools were kind of telling me it was probably ADHD or something of that nature, the teachers were seeing something else. So they were encouraging me to get some more medical testing. And in that time, I also started to surf the internet a lot more to gather information. And on the internet, I learned about Children's Special Health Care, and that it was a local program that could potentially assist with gaps in service and the financial piece. Because I was a young parent, at the time we only had my parents' private health insurance that was covering us both, really. And so I applied for children's special health care. I still really didn't have a specialist diagnosis for my son. At that point, they were calling it severe acid reflux. And in that process, transitioning over to children's special health care, and there was a nurse available that could talk to us and really gave us a lot of direction. And with that nurse, she really walked me through getting some genetic testing for my son and it didn't start with genetic testing, it started with an EDG, that's what it was, a scope of his throat. And in the scope, we learned that he had something called eosinophils that were kind of eating at his throat. And once we got the diagnosis of the eosinophils, we were referred over to Cincinnati Children's Hospital. So we started going to Cincinnati Children's Hospital at the end of the first grade. What an amazing experience. An expensive experience, but amazing for us. So through Children's Special Health Care, they were able to just really help us get this trip together, planned, organized, and they assisted in some payment of some of the travel expense, frankly. And just a little bit about Cincinnati. At the time, they had a specialty clinic for gastroenterology, and specifically kids who had what's now known as EOE. So eosinophilic esophagitis and gastritis is what my son has. And at the time, we learned that it's a very rare disease, but it's extremely rare amongst people of color. There is a genetic piece to this disease, and what happens is these little eosinophils, they eat up the tissue in the esophagus. And over time, so your esophagus is supposed to be very smooth, and when you swallow foods, they're supposed to go straight down. But with the eosinophils being present, they're eating away at the esophagus, hence causing these ridges to form in the throat. And so food gets stuck, and over time, it can cause a great deal of damage. Those ridges can turn into furrows, and people have been known to have their esophagus even close up, hence choking. And it can cause all sorts of long-term issues. But also part of this illness, there is a behavioral piece because, if you're a child and you're experiencing this, there's the anxiety that comes with that. And going through the clinic at Cincinnati Children's, they have this piece where you could walk through an esophagus. And so my son was able to see physically what's happening to his body. And through that experience, he learned how to advocate more for himself, so he could tell his teachers, I'm not sick. You don't have to send me home. It's not germs. This is what's happening to my body. And he learned that it's kind of like a migraine. But for the average adult or the average person, we have migraines in our head, right? So we can physically say, I have a headache. But for him, his migraines were manifesting in his stomach, hence causing him to feel anxious, which caused him to then vomit. So it was a very long, very expensive, but very learning, an experience filled with learning. We went to Cincinnati Children's from first through about 6th grade. And throughout that time, he had children's special health care services the entire time. And what an amazing experience for us as a family to just be surrounded with all of this programming and these services that we would not have prior access to. And it's just interesting to me that we kind of found out about it on a fluke. We found out about this very local service simply by me doing a Google search, whereas we potentially should have found out through our medical offices or something of that nature. But everything that I experienced with my son was because I took the time to learn more about what was going on with him. So on that note, I experienced many barriers to care throughout my son's many years. He's an adult now, he's 22, and he still has EOE. It has caused many issues with his health. He now he's seen by many clinics and programs now because the EOE has advanced to more stages. He has lots of ridges and furrows in his esophagus now, so he still is followed by medical care. And as he's an adult, he faces many healthcare barriers because he looks very normal. He looks very healthy. You wouldn't know that he's an adult living with a very rare disease. And so when people see him, they have certain expectations of him. They don't understand that he's ill and he has an illness. It's very hard for him even at work sometimes because he gets sick and employers don't understand that he needs a moment to go gather himself. So on that note, together we are going to be talking a little bit more about barriers to services here that we've seen with rare diseases. And I just wanted to start us by sharing my story. So,
Thank you, Brandy. I am Becky. I'm one of the nurses on the Children's Special Healthcare Service team. And I just want to say thank you so much, Brandy, for sharing your story and telling us all about Charlie. I'm really happy that you were able to get some of the support needed. It's a little frustrating to me for working in the program to know that you had to find out about it, by doing a Google search. There are lots of barriers to healthcare, getting services, getting things covered, and that's something that we really are trying really hard to decrease the barriers any way that we can. So I was hoping to take a little bit of time just to kind of explain a little bit about what Children's Special Healthcare Services is, how you can obtain it, what's covered, what's not covered, a little bit about just kind of what we're doing to decrease some of the barriers. We still have a long way to go, unfortunately, but I think every step, and even with having this presentation today, the hope is we can get a little bit more of the word out and answer some questions that families may have. Even if we don't know the answers today, hopefully we will sometime. So thank you again for sharing your story. That really, it's a lot. And it's tough because when you have a sick child, that's where you want to focus all of your energy. And you should, but unfortunately, healthcare costs, and that increases the stress, increases the barriers, and you're trying to deal with how he's feeling, how you're feeling, and then in the whole process being frustrated. So Children's Special Healthcare, I guess that's one thing that we really kind of hope the program can at least kind of decrease some of those stressors, decrease some of the barriers at least for pursuing care. So Children's Special Healthcare is a program that's offered here in the state of Michigan. Participants are eligible from age 0 to 21. There are 3 lifetime diagnoses that our program covers. One is cystic fibrosis, the other is hemophilia, and then recently we added sickle cell anemia to our list of coverage for lifetime diagnoses. So that is kind of the eligibility range for ages. The way somebody would qualify for the program is, and I know Brandy had some issues with trying to get Charlie into a specialist, not knowing that he even should be seeing a specialist. But for our program, for qualifying for it, a client does have to be seen by a specialist for a condition that they would be on our program for that specific diagnosis. Our program covers, probably about 2,700 different diagnoses, but it has to be a diagnosis that is a chronic condition. There's a treatment for it, and that they are seeing a specialist at least on a yearly basis. So, and I always use this as an example. If somebody is blind, that is not something that our program covers, because unfortunately there's not a treatment for blindness. So, but there's lots of things that our program does cover. And if somebody does see a specialist, then they can have that medical report sent to the state of Michigan. And that medical report will be reviewed by a team of doctors, and they will say, yes, this client is eligible. The family will be sent an application. And along with the application, there are no income guidelines that has anybody that is not able to be eligible for the program, you can make $0 up to millions of dollars. And if your child has a qualifying diagnosis, they can qualify. There's a payment agreement, and a payment agreement for our program can range anywhere from $10 a month all the way up to $248 a month. And if any family ever was to have questions or want some clarifications about that, we'll put up our phone numbers at the very end where you can reach out, and a lot of those forms you can find, online as well. The other thing is we have really been trying hard to do a little bit more outreach, and a lot of the medical offices fortunately have social workers, so we've done a ton of connecting with different social workers in offices, and we share emails back and forth. We call each other for different things. If there's more information that's needed for a medical report to get approved, we've kind of done a lot of back and forth that way. And even with the social workers in the different offices, they don't have to be the expert. It's, if they can call our local office and we can kind of help guide them, or at least know that they can reach out to us as a resource, that helps things go a little bit smoother. And as probably everybody that's listening to this knows, how more and more private insurance is covering less and less, and things are getting more expensive. Some of the things that our program will cover is if a child is on for a specific diagnosis, our program will cover the medical treatment for that diagnosis, including like the lab work, if there was equipment that was needed, medication, so our program can be used at the pharmacy. So medications can be covered at a $0 copay. There are some caveats with being part of our program. If you have private insurance rules still have to be in place. And then we are considered secondary and always the payer of last resort. So with that being said, private insurance is going to be billed first, and whatever's left over gets billed to Michigan Medicaid. That's how our program gets reimbursed. And as long as families are following the rules where their provider is, in network with their private insurance and then also accepts Michigan Medicaid, there should not be an issue with it getting covered. But as barriers, and as this topic is on barriers, there's lots of different people that are doing billing. There are a lot of details with this program that, sometimes some things can go wrong with the whole billing process. So a couple things that we really like families to know is each child that is on our program, the state will send out a client eligibility notice, which will have their children's special healthcare ID number on it, which is the ID number that you would use as a secondary insurance for billing purposes, kind of like an insurance card. You'll also receive an insurance card for this program. That client eligibility notice will obviously have the ID number on it, the child's diagnosis or diagnoses, if there's multiple, and also we'll have a list of the specialists that are approved for their care. And we always encourage families to look at those lists, because if a family is reading it and they think, oh my gosh, the specialist that they're seeing all the time for this diagnosis is not even listed, that's something that we really need to know about, because in order for our program to cover those services, we need that specialist listed on there. Couple things that are kind of helpful is we don't have to have pharmacies listed. We don't have to have a durable medical equipment provider listed. We don't have to have an anesthesiologist listed. But typically, if you think, gosh, you know what, my kids got private insurance, they've got children's special health care, I shouldn't be receiving any bills. If you continue to receive bills and you call and say, hey, these are the insurances we have and still have problems, those are things to reach out to our office about. Because the biggest thing is, we can't take that pain away, and we can't take the frustrations of, watching your child suffer, explaining their illness to all the different people that are involved in your child's life. If we can just kind of be there to help, even just with, some of the billing pieces, or just kind of having you, use us as a sounding board, that's huge. It really is, because, it's everybody, needs to help each other out. And that's why the whole networking with other providers is so, so important. And then also really having a good understanding about our program, what's covered and what's not covered. And that also leads me to a few things that are not covered. Our program does not cover any kind of behavioral health issues, any mental health issues, or any developmental issues. We do not cover any kind of like autism benefits. Those are things that our program is only eligible to cover the medical diagnosis and the medical side of things, which gets frustrating and which is a barrier. And that's just how the program works. But we really try to be a resource to families. And if we receive calls and we say, gosh, you know what, it sounds like, your child would not qualify for our program, based on what, a family is telling us, we try to give a resource on some kind of organization that can help and support the family. So obviously we work in children's special health care, and that's kind of our expertise, but we try to know a little bit more about what's going on in the community, what other resources to hook families up to, because it's tough. It's really tough. A couple other little things I just kind of wanted to mention is here in Kent County, we have close to 3,800 children's special health care participants. We have a small team here in Kent County of 4 nurses, 2 reps, and our supervisor, Brandy. And a lot of things we try to, problem solve all together, and we try to empower families, to advocate for their children, and we can, kind of help, at least give some of those tools. And I think besides that, and really, I think it's a great program. There's always going to be different barriers. Our program, unfortunately, does not cover any kind of home modifications, but we do know of some resources that may help cover that. So we're not, some families will think, gosh, you know what, my child needs, continuous, physical therapy, occupational therapy. And if it's related to the diagnosis that the child's on our program for, our program will cover that therapy. But unfortunately, it will never cover ongoing therapy. No insurance will cover that. So those are hard things. It's hard information for us to have to share, because, we know when it's your child, you want the very best and you want the most to give them the most, the most tools to succeed. So I'm going to kind of just wrap it up, and I'm going to have Lisa kind of go over a few other barriers to our program.
Thanks, Becky. Becky did a great job going over in-depth explanation of children's special health care, what's covered, what's not covered. I think, with children's special health care only covering medical conditions, a huge frustration that families have is that distinction between behavioral and medical. And holistically looking at a person, we understand that it's all connected. And so that is a big gray area in terms of trying to figure out if a diagnosis, condition, treatment, where is it falling? Is it landing in the behavioral health side, or is it the medical side? And so that is an area that we spend a lot of time problem solving with families and advocating for them. One thing that we'll be looking at would be, has there been a medical procedure, like a swallow study or a scope with a biopsy? From Brandy's example with her son Charlie, is that he did need a scope and biopsy to eventually get to that diagnosis. So we're looking at, has that been done? Is that something that we can submit to the medical consultants at Children's Special Health Care for review? The other thing is, we're looking through the medical report to see, is there a full description of the condition with a treatment plan? Because that's all the medical consultants are able to use to determine eligibility for children's special health care. They need a good picture of what's going on with the child in order to help decide if it's an approval or a denial. It's very frustrating when it is a denial, and we have to call the family and kind of explain the reasons. Becky touched on, the three big criteria being this is a chronic condition, it is severe and needing a specialist visits to receive treatment. And so those are the big three that we're always looking at, because there is a list of 2,700 diagnoses for children's special health care, but they also have to meet those three big criteria in order to qualify. So beyond that, Becky mentioned the different resources that we try to connect families with when there is behavioral or mental health services that are needed. The big one in Kent County would be our local community mental health, which is Network 180. So I recommend people check them out, and they have a website and an access center to call and ask for services. So besides families experiencing a barrier with the medical versus behavioral, a barrier that we see with providers' offices where they are trying to figure out what is children's special health care, what does it cover. That is a very confusing program for them. And so one confusing item would be, what is the difference between Michigan Medicaid and children's special health care? So Michigan Medicaid is a comprehensive health insurance, which means it is intended to cover all medically necessary care. Children's special health care is only to cover the care for the diagnosis on the children's special health care list, the approved diagnosis. So, but in terms of billing systems, we're using the children's special health care is using the exact same billing system as Michigan Medicaid. We're also following the Michigan Medicaid policy and their standards of coverage and their rates and reimbursement. So there are a lot of overlapping things to do with both programs, but that's just one way we try to clarify for providers to understand better, what the coverage entails. The other thing is, right now we are, answering phone calls and emails from the nurses and social workers at those providers' offices. Prior to the pandemic, it was really great when we were able to network and meet with them in a room face-to-face, do a quick overview of the program and answer their questions. Also developing those relationships between our little team and all those different providers around us is just really great, because you get to know them. You're able, to figure out, guess what? I see that this is missing. Is that something that you can do? And the nurse or social workers, oh yeah, I'll get on that. I can get that submitted to see and be reviewed by the medical consultant. So that's really great. Some of the behind the scenes ways that we help out. So. So we're eager to be able to get back and do outreach again and be able to, see the, face-to-face with those provider offices. So.
Thank you, Lisa.
Thank you.
I wanted to touch on just a couple things that Lisa had brought up. One, just with the qualifying factors to qualify for children's special health care with, it has to be a chronic condition, has to be seeing a specialist at least yearly, and also needs to have a treatment plan. That's another frustration sometimes is we have seen some denials based on a treatment plan where there is no treatment plan. We see it for a lot of kiddos, especially if they have a heart condition and they need to have like an echocardiogram and things monitored. It's really tough because our program doesn't cover monitoring, and as much as we would really love for it to cover that, until there is actually like a treatment, will our program cover it? So we do some problem solving, with families and with the specialist to see if there is anything that could be done to deem it as a treatment, but a lot of times those kind of things don't end up getting covered. So I guess whenever I talk to a family, I always just want to say, you know what, if you have a question, if you're wondering if something will be covered, let's, just ask, and we can always see what the state says and kind of go from there. So I never really like to say no unless I know for sure it's a no. So there's sometimes we don't want to ever lead anybody down, for any kind of false hope for things getting covered, but we really do try. And there's some different avenues that we try to take just to kind of, really help families out, because that's kind of the whole goal is we would never want a child, not to be seen by a cardiologist because it's not going to be covered. So there's some different things with that. A couple other things that I have seen not get covered. And unfortunately, one was EOE because there wasn't much of a treatment. It was an over-the-counter medication, and it wasn't considered severe enough. And as much as I would want to argue it, and I did, it ultimately ended up being a denial. It was not something that was covered. One other thing that I really wanted to touch on is, I know with Brandy's Charlie, they did end up going out of state to Cincinnati, which I know, and from probably most of you families that are watching this, that if anybody has a child that has any kind of GI issues, you've probably heard about Cincinnati. Fabulous. And I also know that was a few years back when Brandy went. And so, and it was before my time working in children's special health care, but I do know for sure that they do have a medical team here at DeVos that has done a really fabulous job, you know, treating kiddos with EOE. And any kind of out-of-state coverage for our program is never a guarantee, and there are quite a few steps to take just to try to get some out-of-state covered. And one caveat that I really would like people to remember is anytime out-of-state ever gets approved by the state of Michigan to be covered by our program, there has to be no comparable care here in the state of Michigan. And so if you have a specialist here that says, absolutely, there's nobody here I can refer your child for such and such procedure, you know, I'm going to recommend you to go out of state, that's when you really need to contact your local children's special health care office, because there's quite a few things that kind of need to get approved and sent in to see if that can end up being something covered. So I'm really glad that you guys were able to go, because I've heard just fabulous things about their program, and I'm glad it was a positive experience. But I don't want any family to ever have any kind of like false hope that, oh gosh, you know, we definitely, you know, we're going right over to Cincinnati right now kind of thing. You know, but I never like to say no. And if a family was to say, hey, you know what, Becky, I have, you know, heard great things about this from this out-of-state location, can kind of talk through the process and kind of, we have a whole thing that we share with families all the time where it's like the out-of-state family responsibility. And so we email families so they're well aware of kind of what is needed for approval, because that's the other thing is we don't want anybody to ever go with any kind of false hope thinking things are going to be covered and then find out later they're not. You know, so we try really hard to not promise anything, and, you know, really, you know, to really make sure families can get the most out of our program, you know, to benefit them. The other thing I did want to mention is, I know when I talked a little bit just about like the payment agreement and being part of children's special health care, you know, I know with Brandy mentioning that there's a genetic link to the EOE, and as we know, there are a lot of different genetic components to a lot of, you know, rare diseases, and, you know, and that means, you know, there might be several children in one family that all could be eligible for our program. That family is all under one payment agreement. And so it's not individual ones for each child that would be on our program. So that's something that we always like to try to tell families when we talk to them, is it's one payment agreement per family. And the other thing is, once a child turns 18, they're considered their own family. So it's based on their income. So those are just a couple things that I really, you know, just kind of wanted to mention. And then we do have some information that we'd really like families to really kind of consider just for when to really reach out to us. And, you know, so please kind of look at that. Just be mindful, you know, of some of those things, you know, insurance changes, if you ever lose insurance, change insurance, those are things that we really need to know, because obviously those are the payers of services, and so we don't want, you know, things to get messed up with billing. You know, there's, you know, if you have providers that are not listed on your client eligibility notice, those are things to let us know about. You know, If you have billing issues that haven't been resolved after you've called and said, hey, we've got the secondary, those are things that we really just, definitely let us know, and we'll help as much as we can. I'm going to have you go, Brandy.
Thank you. And, great points. Comparable care looks very different now than it did when my Charlie was younger. He's 22 now, and we stopped going to Cincinnati, I believe in 2012, because services had just drastically changed here in Kent County, and so now we have lots of people from around the state coming here for care, and the doctors here were excellent, just like we were receiving in Cincinnati. We wanted to also note that we totally recognize that these barriers we mentioned are not all the barriers that families face. We've talked to families who have mentioned, language being a barrier. We have lots of families from all over the world here in Michigan now, especially in our area here in Kent County. And sometimes the language barriers feel like a deficit for the family, so they're very scared already about reaching out for medical services. And really, it's intimidating being in this county because there are so many services to choose from, so you wouldn't necessarily know where to hone in to receive care, so that's a barrier also. We also recognize that housing is a huge barrier in our county. Affordable housing, safe housing, stable housing. We recognize that some of the families we deal with and encounter, that's a massive problem for them. We encourage them to seek out services here in Kent County. There's a variety of housing services that you can tap into, and we have had conversations with families about that. We don't always have the most up-to-date information because that is not our forte. But there's something to be said for having a safe, stable space where you can receive your notifications for medical providers, and so that children have a safe space to be sleeping in, living in, where they can be healthy and safe. And as we wrap up, we wanted to note a couple things about our program. We offer children's special health care. We have a parent support group that meets second Tuesday of every month from 5 to 7:30. For the months of January, February, March, we are meeting virtually, and you merely need to reach out to us and we can get you more information on the parent support group. We also have a parent listserv where we send out information via email on a monthly basis about things that are happening in the community. And finally, we also have a Facebook page, Families with Special Needs Connect, where all of the information that we provide and send out an email is available there. And it's a great space for parents to meet and connect about just the barriers they face, and they share information about their children, and they just fellowship together there on the Facebook page. So that is an excellent tool as well if you're interested. If you have any questions about Children's Special Health Care Services, our contact information is listed for you. Feel free to reach out, and this has been great. Thanks for joining me today, Lisa and Becky. I appreciate you.
Thank you, Brandy.
Thank you.
Thanks again for sharing your story.
Yeah,
Thank you.
Thank you.
Thank you.